Oh, good morning and welcome. This is our legal and policy track. Keep my data private and secure. If that's what you're expecting, you're in the right place. My name is David Collins. I'm Senior Director for mHealth, and it's my pleasure to have the opportunity to moderate this session this morning. We have a treat in store. I've worked with these panelists behind the scenes preparing for today, and we have a wealth of knowledge that's going to be shared. We have Dr. Andrew Litt, Chief Medical Officer with Dell Healthcare. Omar Hussain, President and CEO in Privada. Rohit Nayak, Vice President, Physician Technology Solutions Care 360 with Quest Diagnostics. And Penelope Hughes, Program Support for the Office of the National Coordinator. So just to give you a sense of the program flow, because I know each of these sessions are a little bit different, we have 75 minutes together, and I'm just going to kick it off with just a kind of a brief overview of the types of topics that this session will cover. Then each panelist will have 5 minutes just to discuss their perspective on the topic. And then after they go, we will actually have, the remainder is going to be a lot of dialogue, a lot of discussion. And we really do encourage your questions. Bring your lessons learned forward, bring your challenges forward, and let's have some interactive dialogue for this session. So feel free to jump up to those microphones in the center when we get to that point, and get the most out of this for your benefit today. So regarding privacy and security in the mobile space, the HIMSS Analytics Mobile Survey was just released yesterday, and privacy and security is on the top of one of the challenges for mHealth. Not a big surprise, and that's true in eHealth as well. And this particular session, we will certainly address the implementation of legal challenges related to mHealth around bring your own device. Bring your own device, BYOD, is certainly a big discussion topic. Outsourced cloud. The total avalanche of available mHealth applications for both the providers and the patients. HIPAA and other privacy laws. Security challenges. Consumer perspective and use of apps. Remote monitoring from home. Basic creative use of real-time location services. So a real breadth of topics that covers this area. And I think the interesting thing too with this panel is you're going to hear physician hospital perspective, you're going to hear ambulatory perspective, you're going to definitely hear the consumer perspective woven throughout. And as you know, the consumer engagement and patient perspective is becoming more and more a focal point, as it should be. On that note, I'd like to turn it to Dr. Andrew Litt, Chief Medical Officer with Dell, and he'll get us started giving a big picture of the mobility trends in healthcare and how those relate to privacy and security. Dr. Litt.
Well, great, David. Thank you, and good morning to everybody. And so I think this is a really important conversation for all of us who work in healthcare and in eHealth and in mHealth, because what we're talking about in terms of privacy and security is not sort of some abstract concept or something that needs to get checked off in a compliance audit or whatever. This is really about trust between patients and the people who take care of them. Because if patients don't trust their caregivers with their data, they're not going to trust them with the outcome of their health care. It's sort of fundamental. And I just want to read you some numbers from a study that was recently done where they surveyed patients, and I know Penelope will talk about some stuff that ONC has done in this area, but this is a different study that was done where patients were surveyed about their views about healthcare privacy or their patient data privacy, and what they would do if they thought that the data was not secure, meaning if they thought the data could be exposed to others. 54% of patients would withhold information from their physicians or their other caregivers if they were worried that the data might get exposed. 38% would postpone seeking care they might not even get care. Another 38% would go get care to someplace else if they thought the other place had a better security or privacy system. And 73% overall, which is probably the most important thing, said that this would reflect poorly in general on the quality of care they thought they were getting at the institution. And the one I think that's most interesting for those of us like myself who were former hospital executives, 87% of patients thought that hospital executives should lose their job if there is a breach in data security or in PHI. So that should be sort of a warning, because when that percentage of people believe something, the politicians tend to, and the regulators tend to kind of follow behind, understandably and correctly so. So that's something that we all who are in this world should be concerned about. So this is basically about trust. And why is this such an issue now? At Dell we talk about the perfect storm of healthcare data and security and privacy, because there are really four factors that are happening, and they're going to get talked about a lot here, I think, during this panel. One is this explosion of data. And mobile is a big part of that, because once we can start to track data coming from and going to individuals wherever they are, that just increases the size of the data. And if you go to the exhibit floor down below and you look at all of the different ways that data can be added to the system, the amount of data is just growing at incredible rates. And then you think about things like genomics and proteomics, where we're talking about terabytes of data per person, and that's just making it even more complicated. Frankly, the threats on the security and privacy side are getting greater. The people who are doing hacking and that sort of stuff are really getting pretty sophisticated, even more so. And I will tell you that, that our research shows that hospitals particularly are among the most favorite targets for the professional hacker group, those who do this for a living, and there are people who do this for a living, partially because hospitals are so badly protected right now. As a rule, this has not been a priority for a lot of CIOs in hospitals, and now it will be. BYOD, as David said, I think is another big issue, which we'll talk about. And finally, as you all know, the compliance and the regulatory issues are going. 60% of healthcare providers have had 2 or more breaches in the last 2 years, supposedly. I don't know how we exactly know that, but that's the statistic. And the value of a healthcare information package, meaning entire healthcare history, on the black market is $50. By the way, the value for your Social Security on the black market is $5. So just for your Social Security number, the one item. So healthcare actually is worth more than just the Social Security number. So finally, I want to just say that 65% of data breaches that currently exist are related to a mobile device. So mHealth is right in the target. This is the area that we have to be #1 concerned about. Now, part of it is because the overwhelming majority of breaches that have been reported today, or certainly that the Office of Civil Rights and HHS has tracked so far, are due to loss or theft of that device. You know, and we all know the story about somebody leaving the laptop on the T up in Boston or whatever, where there's some device that people can get access to that's not encrypted. So I think mobile is an area that needs almost more than any other to be putting privacy and security up front. And I hope those are some of the issues we'll talk about here in this panel. Thanks.
Excellent. Thank you very much, Dr. Litt. And some interesting points that you brought up. When we circle back around for open discussion, I'd like to hear more about your former hospital executive experience and tie back to that with what you know now and your current role. And then I like how you outlined the perfect storm and those 4 factors. So we'll spend some more time there. So thank you. Omar Hussein, and we're going to start off with a story of how patient data is a challenge to keep it secure.
Yeah, I think, you know, the biggest perspective is that, to put it into context, when Imprivata started, we were a security company, and 5 years ago we became a healthcare IT security company. And you'd say, well, what's the big difference? Well, you have to really understand that every other industry, security is a single issue, keeping the bad guy out. So all they're worried about is the hacker in Eastern Europe and South Asia or wherever trying to get in and break into get your social security or credit card information, etc. So that is the fundamental premise of all security, keeping the bad guy out. In healthcare, it's not just about that. It's actually keeping patient information in, which is the unique thing. So when a hacker breaks in, someone takes your credit card, charges you up or wire transfers money out or steals your ID, the bank will make you whole. They will reimburse you for whatever charges happen. Someone takes your card, runs up a bill of $1,000, you'll get the $1,000 back. But if accidentally it finds out that you had an STD or you're taking some medicine for antidepressant and it came out and you didn't want it to come out, how do you put that back in? And so that's why personal information and securing personal information becomes so critical in order to make electronic healthcare work, particularly in the mobile environment. One of the interesting stories is that, how many of you have an iPhone out here? Okay, everybody uses an iPhone. So I am one of the few, the last remnants of BlackBerry. So I actually don't understand this problem until recently. So in BlackBerry, you have BBM, which is a secure messaging server, and I BBM everybody, and nobody can ever see my BBMs other than the person on the other end. So recently, I bought my kids iPhones, and I have an iPad at home. And if you sign in and send a text message, so apparently, all your text messages can be seen on your iPad. So one day I'm going and there's like, I click on this message. I never use, an iPhone or my iPad for messages, just for entertainment. So one day I click on the messages and I can see every text that my son and daughter have sent to their friends and what their friends have replied. Now I have a moral dilemma whether I should tell them or not that I know this. They're 16 years old, so you'll understand that right now I'm going through quite a moral issue internally, whether I should let them know. But that's how open it is. And here's the ignorance of what we do. Texting, for example, is the most common form of communication in the world. It is the easiest form of communication in the world. Grandmothers do it, mothers do it, friends do it, we do it with each other, we do it with our colleagues, we do it with friends. And guess what? In healthcare, it's widely used. I had a meeting with a chief medical officer one day and asked him about, whether his institution used texting. And they said, nope, nobody uses texting in our institution. Nurse is not allowed to carry a smartphone on the floor, and none of my doctors will ever text. Then I asked the CIO over lunch. He said it was the single largest problem in his organization because they text all the time. They send patient information back and forth. They will ask patient in room 214, Mr. X, needs drugs increased, or someone has come into ER and he's got some rash on it and said, this guy's come in, this is his rash, what do you think? He'll send it to a specialist, someone will comment back. Now, forget that it's a HIPAA violation, but it's right out there in the open. And once in a while, in a blue moon, the information gets out and the patient finds out that something they didn't want gets out there. That's when you have a real problem. And to what Dr. Litt said earlier, a lot of hospitals and institutions, it's not the fear of breaking a HIPAA violation and that you'll end up going to jail. No one's actually done a perp walk. It's actually the issue is you'll be sued. You'll be sued by your patients if their information comes out. And that's why this is such an integral part of the adoption of technology in healthcare, is figuring out how to keep patient information secure while not letting it get in the way of the providers providing good patient care.
Excellent, thank you. And I think that's a theme that everyone can relate to. It's so pervasive in our day-to-day life. We just text, we use Facebook, what have you, and it's probably not a second thought for a provider to get on Facebook and have a discussion about a patient with a colleague. And that's just not where you have these types of discussions. But you don't want to hinder patient care in that communication. So, great overview. Thank you. One thing I meant to do in the beginning is just take a quick poll of who we're talking to. That's kind of important. It's kind of like leaving the patient out of the healthcare circle. It's not a good thing. Just a show of hands, who here is from a hospital health system environment? Okay. Payer perspective? Great, thank you. Vendors? Very good. Patient representatives? Oh, come on. Consumers? Okay. Entrepreneurs? Okay, great. Any other categories? No? All right. Okay, excellent. Thank you for participation there. And Rohit Nayak will give us a snapshot of the ambulatory physician perspective and the role of mobility in care coordination. And did you want to have your slide up?
Sure.
Here we go.
So I was just following the comments my colleagues made. First of all, thanks for giving us the opportunity to be here. I'm sure it'll be an interesting conversation. I think, our challenge really is, with the cross-section of the folks that we have here, is how do we balance, if you will, all the sobering thoughts that we've heard, right, of all these different examples around, the possible breaches or actual breaches of how this information is shared in today's world, versus what we're trying to do in healthcare, right? Trying to make it better, trying to get the right information to the right person at the right time, get people access to information as much as possible. I represent Quest Diagnostics. I represent the Care 360 products group within Quest Diagnostics, and where we're responsible for developing the customer-facing solutions that Quest Diagnostics offers for its customers, the range of customers that we deal with. We have a lot of data, so taking a slightly different perspective. We touch about 125 million patients, you and I, on an annual basis, and so there is a lot of data out there, and these are topics that we deal with on a daily basis. We work extremely hard in terms of trying to find ways and means to get that information as quickly as possible to the people that need it, right? So I'll start off with in working with 125 million patients, we also work with about 200,000 providers who use our various solutions, and providers use that information, use those solutions as a means to place orders with Quest Diagnostics and receives those results in all its various manifestations. So that relates to around 80,000 practices, ambulatory practices that use our various forms of technology, including Care 360 EHR. We also work with finding ways to interface or interact with all the other ambulatory vendors that are out there in terms of helping them interface with Quest Diagnostics for the same transaction sets that I just talked about. So there's a lot of experience that we've gained over the years as we've set on this motion of how do we take the services that we provide, the content that we generate, the information that we generate, and get them to the right sources, if you will, from an action standpoint. So I talked a little bit about that from a provider standpoint. We've also heard, I mean, in every survey that we have around how do we drive now on the patient side, right, on the consumer side of the equation, how do we drive better adoption of all the different technologies or solutions that are out there that help us as individuals manage our health better, right? Because we believe that knowledge will help us individually then, be more compliant, if you will, with all the different assets of what we need to do to manage our health. And that's when we came across, and I was surprised when I first found this out about 5 years ago, that there are significant policy roadblocks, if you will, at the very state levels in terms of how labs can directly send or cannot send information directly to a patient. It first needs to go back to the provider, the ordering provider, and then the provider has to make the choice or the action to share it with the patient. And I think we can all share, and we've had enough conversations on this particular topic in terms of all the different experiences that we've had with our own individual providers in terms of trying to access that information. A couple of years ago, Quest Diagnostics took the step forward of launching a solution that's a patient-facing solution called Gazelle. It's downloadable on the App Store or the Android platforms, where you can basically, sign up if you use Quest Diagnostics and use that platform to access information. And we had to go through, all the things that Omar just talked about, the multi-factor authentication of proving that Rohit Nayak is Rohit Nayak before you do that, identifying the providers and so on and so forth. So we're doing that, but yet we're learning a lot there as well in terms of what we're doing. I just wanted to share a couple of different points that I think reflect back on where we were and where we came in this whole notion of driving adoption, if you will. I remember, many of you remember probably, in terms of at least my experience many years ago, about 10 or 12 years ago, e-prescribing was a hot topic and still is, right? We've made a lot of strides in e-prescribing over the last few years. But every commercial or every topic around e-prescribing was this physician in a white coat and holding a PDA in their hand, if you remember that, right? And that didn't work then, although it was a great notion. It didn't work then for a lot of reasons. I think the security aspects were one of them, but fundamentally all of these devices were devices that were handed over to physicians to say, use this, it's great, it'll help you, prescribe electronically. In some of these cases, the technologies were just not advanced enough. What we saw 2 years ago, in 2009, so that makes it 3 years, I guess, was phenomenal in retrospect. We had a skunkworks project within our Care 360 division that basically took the same Care 360 application that was a browser-based application, and we created a native iPhone app for this. And what we found was phenomenal. I mean, with absolutely no promotion, because it was a skunkworks project, we suddenly had huge numbers of physicians or providers that were supposedly using our Care 360 solution. They already had their user IDs, but they didn't have the passwords because they'd never used those solutions, right? I mean, you always delegate the lab work to somebody else. And these people were calling us, our support desk, to say, I need my user ID and password, and that was a really interesting phenomenon. The second thing we found was that, one would assume that they would use this information typically when they're at home or when they're not in the office and so on and so forth. And through a variety of circumstances purely around the network IPs and all that, we were able to decipher that a lot of the utilization by the physicians, these mobile devices, was actually occurring in the office environment while they were between patients, all right? Or because the chart wasn't handy and so on and so forth. So I bring up some of these examples of the adoption side of things, purely from the standpoint of saying that there is an important task here that we have to manage and balance, between all the different aspects that we're talking about, that are the negative aspects of the sharing of information in a prolific manner, versus how we do that to allow us to actually manage this together. And I think this becomes particularly important when we make the premise that everything that the ONC is doing, and I'm sure we'll hear a lot more about that, is around how we share data, right? It's all about care coordination. Everything that anybody and everybody is talking about ACOs these days, it's about care coordination and how we make that data available, our own personal data available between all of those. So these are topics I'm sure we'll get back to again, but again, this.
Excellent, thank you. That's a great overview. And I know, Quest isn't specifically into e-prescribing, but the topic itself related to e-prescribing controlled substances, that continues to be an area that needs to be figured out. I know a final rule is out, and there's guidance on what's acceptable, but it's still not, in day-to-day activities. So it'd be interesting to follow back up. And your points along adoption and the Gazelle platform, that should be something we go into some more discussion. Penelope, and your overview, please.
And I have some slides, I think, I was going to go through. So I'm here today to talk about the results of a series of focus groups that we held. I'm with ONC, and we looked at consumers' views on mHealth and privacy and security issues. And just as background, there's growing evidence of the potential benefits of mHealth. And by mHealth, for the purpose of this presentation and our study, I'm speaking pretty broadly and encompassing any use of a mobile device to send or receive health information to or from a provider. Sorry about that. So including texting, Skype, apps, etc. And HHS has had mHealth on its radar for a while now and has led a number of efforts to examine various aspects of mHealth, including the Text for Health Task Force. And that's, this project developed out of that. The task force recommended specifically that there's a need for additional research on privacy and security as it relates to mHealth and texting. And so just to frame the landscape, there's been continued growth in the uptake of mobile devices and increased use in them for health purposes. And I think it's especially important to remember that the huge potential of mHealth to reach underserved populations. It can reach folks in rural areas and people who are cut off from services, and then also certain underserved populations are really embracing this means of communication. So mHealth has the potential to really help a lot more folks get engaged in their health care. And this is just a little bit about the focus groups. It was a quite large project. We had 24 focus groups around the country in 5 diverse regions. We had both rural and urban focus groups. We had Spanish language as well as English language groups. We made an effort to include underserved populations, and then we worked with community-based organizations in the area to recruit and actually conduct the focus groups. And so just a little caveat about the findings before I discuss them. These are focus groups, so they're exploratory in nature, and really any finding needs to be further researched and replicated. And also, because of the nature of mHealth and technology in general, which is so fast-moving and dynamic and evolving, it really just represents a moment in time. And then it's important to know that while we were looking at privacy and security issues, there were a number of other issues that were very important to consumers around using mHealth. In particular, concerns on the part of the consumer or patient about being able to follow up with the provider and ask questions, and being able to somehow keep from losing that human touch when you have an mHealth interaction with your provider. But the core question we were looking at, privacy and security, the key finding is that consumers do have concerns about privacy and security of mHealth, and these concerns do present a barrier. However, the concerns are on a continuum, and they're highly contextual, so there's a wide range in the nature and extent of the privacy and security concerns, all the way from folks who feel that they have nothing to hide, so they don't even think about privacy and security, to people who are tremendously concerned and would just avoid technology as much as possible. But importantly, there are several factors that emerge that are really critical in determining where people are on this continuum. So these are factors that can make people more comfortable with mHealth and with the privacy and security issues. And so the first is control. This was very important to consumers. Consumers were interested in having some control over access to their information, and where they had more control, they generally felt more comfortable about the privacy and security concerns. Another big factor is context, so the type of information that was being sent or received, sensitive information, in particular, heightened privacy and security concerns. And then trust was a key factor in the provider as well as technology. And in the Spanish language focus groups, provider trust was particularly important, so that was interesting. And then technical literacy, that emerged as a critical factor in how a consumer viewed privacy and security concerns, and in particular how they weighed the benefits and risks. And so those with greater technical literacy were better able to do that and make decisions about using mHealth despite privacy and security concerns. And so these were really interesting implications that it sort of suggested things that you could do when you're thinking about how you're going to send information and what type of information you're going to send, things that could make consumers more comfortable. And so in the interest of time, I had these broken down by types of communication. I'm just going to go through these these quickly. These are just some of the things that consumers would be more comfortable if these were implemented. But things like controlling when and how often they receive text messages were very important. It's important to note that text messaging in general was considered the least secure method of sending and receiving health information. And they would like to know that texts or emails are actually from the provider. That makes folks more comfortable, as well as having confirmation that the text or emails were actually sent. They also generally wanted to have clearer expectations from the start about how the communication was going to go and when they could expect to hear back from the provider. And then they also really wanted the provider involved in introducing and instructing them on the use of the technology. Those were some things that made them more comfortable. And then as far as the type of information being sent, certain types of information clearly had greater privacy and security concerns attached. Generally, things like diagnoses or actual lab test results. And lab results are an interesting example. That consumers generally were fine with having the announcement that this represents that your results are ready sent via text, but they did start to have privacy and security concerns if the actual results were being sent to them via a mobile device. And then there are a few other consumer preferences that came out around GPS. And these, again, you can see that they relate back to control, and where consumers feel that they have a little more control, they are more comfortable. And we also looked at safeguards, and generally they were interested in safeguards. And then these were just the key takeaways. Consumers do have privacy and security concerns, but they make these determinations on a case-by-case basis. And some of the key factors are technological literacy was very important, as well as provider trust, having some control, and then thinking about the context or type of information you're communicating. Sure.
Okay, there's some food for thought right there. No, that's great feedback. And from that, I think we'll springboard a little bit into a discussion, because what we just heard provides opportunity and it provides challenge. How do we optimize mHealth when we have this hybrid environment? We've got technology that we can utilize for better efficiency and access. But we just heard we've got concerns as well. Tell me information. Let me talk to my provider. Don't send me stuff about my diagnosis. I don't want to see photos. I don't want to see lab test results or any bad news. But I want access to my provider, and the provider, wants that efficiency as well and dialogue. So, how again, back to the question: how do we optimize mHealth within this hybrid environment?
Well, I think it just depends. I mean, one of the things I would add is that you have to keep one thing in mind, is that healthcare is a unique industry. Every other industry in the world has been through evolutions of technology that has improved efficiency, productivity, security issues have been addressed, and literally banking, finance, manufacturing, everything. Healthcare is starting to do this globally, is starting to embrace technology as it enters its next evolution. The problem is at the same time that it's entering it, technology is going through a huge and massive change. I mean, if you think about the fact is that, I read a survey that, less than 17% of physicians used an EHR or EMR because they thought it was clunky, not easy to use, was very difficult, hated using it because it was, challenging. Yet 58% of them own an iPad and use it frequently to do multiple tasks, including looking up information that they want around, drugs or efficacy of drugs, etc. So what's really happening in technology is that you have these two vectors that are sort of colliding. One is the evolution of technology, and the other is sort of security and privacy. And as we all get better at building better solutions and better systems and trying to make those systems more pliable, we'll find that technology will become a standard means of not only just connecting with patients, but in the future probably a mechanism of providing care to the patients. I'll let Dr. Litt.
Yeah, I mean, I think those two sort of parallel and also crossing trends, I think, are the challenge that we face. I think the other issue is, while this conference talks about mHealth, mHealth isn't one thing. I think Penelope sort of referred to that. So there's the consumer-focused piece of mHealth. You know, how do I relate to my doctor? How does my doctor communicate with me? All of those kinds of things, right? Very important. But it's one area. And the other area is sort of mHealth, kind of almost within healthcare, within the healthcare professionals themselves. How do I communicate, as a physician, communicate to other physicians? How do I look up information, get information about my patients, get information about diseases, get clinical decision support, all of those things. The standards need to be, you know, sort of similar in terms of how we protect things, but I think the way we'll get there will be different. It won't be exactly the same, and one could imagine different technologies in different kinds of situations.
Yeah, just wanted to build up of what we heard here. I think we have a tremendous opportunity here. The way I see it is there's a difference in terms of what we're looking at today versus what we have historically seen in the healthcare environment, and that is that we have people that, of their own accord, right? These were the same folks that we call technophobic, that we had two tasks in front of them previously. One was the solutions, and the second one was the device or the technology that they would use the solution. And of course, data entry is a big issue there. But in today's world, and this is what we saw with our skunkworks project, that we obviously expanded now to, you know, include other devices as well, is that we have our audience here, you know, choosing of their own accord to go ahead and acquire these technologies for a host of other reasons. And if we find a way to intersect and become a part of their system out here, you know, I think we got most of our problems covered here, and from an adoption standpoint. And we just have to be careful, and I guess this is the part that I was trying to echo on earlier. We just have to be careful that as we standardize and build on all the required layers of authentication and security, most of which are already there out there, that we don't make it onerous, you know, such as what we've been struggling with. I mean, you referenced e-prescribing and the multi-factor authentication needed for controlled substances. That has become an issue in the industry that we're still trying to get around. So, but I think the key point I was trying to make is tremendous opportunity out here for us, you know, to take this and move this forward.
Yeah. I mean, I think, you know, Penelope said something that I thought was very interesting, is that you said that in your survey or research you found that people found texting, for example, to be the least secure, right? Yes. Yeah. And yet globally, after phone communication, the single most commonly used mechanism of communication is texting, right? So until we figure out how to make it secure and easy, and that's sort of our what we do is try to solve those problems. So if you can provide people that are secure, you know, compliant texting solutions, then the rate of adoption will be huge. I mean, you know, we launched a product 2 months ago for secure texting. I mean, I've been doing this for 25 years for software companies, and in, you know, less than 6 weeks we have 300 hospitals that have downloaded this and start to use it. Now, why are they doing this? I mean, we haven't even started marketing this and people are doing it because there's a latent problem. People want to solve the problem. People actually want to do the right thing. And when you talk to physicians, they want to do the right thing because they care about their patients. They don't want to put their patient information out there inadvertently. They always want to do the right thing. And I think you just brought out the point is that the balance is between security and convenience. You want to make it really secure. You want to make it as secure as it needs to be. But it cannot get in the way of delivering care, because the minute it gets in the way of delivering care, then everybody will bypass it, and then you have a problem.
I was just going to say, I think, just to sort of expand on that last comment, I think it's, you know, people describe doctors, and I'm going to speak as the doctor on the panel here, right, as technophobic. And I would take some exception with that. First of all, I'm a neuroradiologist. I can't get more technologically oriented than what I am. You know, I used to use big MRs and all kinds of stuff. And you bring a new piece of technology into the OR, whether it's a surgical robot or image-guided surgery or whatever, and, you know, laparoscopic surgery, and the surgeons will run to do this because they like new and exciting stuff. What they don't like is things that make their life harder and more difficult and take longer. So, you know, e-prescribing is a great example, right? It makes sense, it's logical, frankly, it actually improves patient care, but there is nothing faster than scribbling an illegible note on a prescription pad. I mean, it's just a lot faster than any e-prescribing system that currently exists or that anybody's even imagined. Now, are people moving in the right direction? Of course. So I think there is a balance of usability and sort of the technology that comes into this as well.
Yeah, absolutely. And that's an interesting point because just prompted thought from the HIMSS Analytics Mobile Survey. One of the primary concerns of physician use of mobile technology has to do with speed. And that was like number 2 on their list. Screen real estate and resolution was number 3, which used to be a higher issue, but now with the technology that's out today, it's kind of it's still a factor, but it's not what it used to be. So to bridge off of this discussion, Penelope, back to your focus group outcomes. I'm interested in if there's any differences in attitudes, demographic-wise, around privacy and security. And then, Dr. Litt, I wanted to move off of that and kind of talk about what's required for meaningful use related to privacy and security. So.
As far as the focus groups, it was interesting. There were not major differences in attitudes and preferences on the basis of demographics that emerged in the focus groups. And so that's especially interesting, you know, the fact that age was not associated with greater or lesser privacy concerns or particular privacy or security-related attitudes or preferences, because I think you typically think of it that way. But we had, the focus groups were divided by age, and in every age group, so younger folks or you know, seniors, they had that same continuum of privacy and security concerns, with some being very concerned, others not concerned at all, but most in the middle. So that was a really interesting finding.
Yeah, I mean, I think that sort of speaks against a lot of what our natural sort of intuition would be about age and that kind of thing. So to shift a little bit to meaningful use, I think, you know, most of you know what it is and what it requires. I think the key part about meaningful use in terms of privacy and security is that you have a plan. And how many places don't even really have a good plan for assuring security and providing? Have you done a risk assessment? Have you done the formal process of doing a risk analysis and then modified whatever faults or areas of potential concern are in there and done the analysis again, you know, next year? Is there an ongoing process here? Because I think that's the other piece about security and privacy that's really important. This isn't a one-time issue. It isn't like, okay, I can create an app or I can create even a secure texting solution, and then it's done forever, and, you know, there'll never be a challenge to it again. I mean, the people out there who are working sort of against us, they have long-term interests too, and they're trying, you know, and they get better every year. So we have to get better, and the users also have to get a little bit better. So I think that's really the issue in terms of the security. The other piece, and I think this is most important vis-a-vis mHealth, if you're an institution, whether it's a payer or a provider, is where is the data? And that sounds like such an obvious thing. Oh, the data's in my electronic health record or my EMR system. Well, yeah, it is there, but I'll guarantee you it's in 50 other places too, including, you know, a thumb drive that somebody downloaded because they needed to do some work at home, and then they lost it, or whatever, right? So that issue about where is the data and really expanding one's perspective on that problem, I think, is really important.
A couple of things on meaningful use. You know, well, we're an EHR solution provider with Care 360 EHR, and so what we're finding is even in stage 1, right? For the certifications that the providers have to do to get their money, so, you know, the 18K or 15K for the first years. One of the weakest areas in that whole proof points is the security assessment. And of course, I think it's going to get interesting depending upon the level of audits that that CMS decides to do on these particular practices by what is a security audit. And I think, you know, since we have a representative from ONC here on the panel, I think it's extremely important for us, you know, collectively to set the right expectations, you know, in a you know, sort of a layperson standpoint. A security audit is to make sure you do this and this and this, you know, and find a way to sort of, you know, remove the clutter behind, you know, a whole bunch of consulting companies coming in and you know, descending on these, and I'll say specifically the ambulatory practices that have no idea really what that particular concept really means beyond, you know, some of the higher concepts. The second dimension I just wanted to touch upon, meaningful use, and maybe a broader topic. So, David, I mean, if you want me to come back, is the orientation of the patient, right? The meaningful use, and the ONC has done a tremendous job, both in stage 2, in stage 1 initially started, of course, but stage 2 for sure, in terms of what is required in terms of providing access to us as patients, right, with the individual providers that we talked about. And I think it's also fair to characterize and say that from a solution standpoint, from a vendor standpoint, most of the industry is quite not ready yet to allow for that bidirectional exchange of communication and dialogue that is necessary in order to sort of get to our, you know, sort of the orientation of care coordination. So I think it's going to be really interesting for us, you know, as we sort of dovetail these you know, the right best practices, if you will, from a security standpoint, put in the notion of adoption, right? Because now you've got multiple stakeholders here that need to, right? That need to interact with each other in order to get to the care coordination objectives that everybody's trying to drive. So I think it's getting into a dimension that's really fascinating.
Perfect segue, exactly. And, you know, Penelope, if you might be able to address a little bit about that in terms of what your office is, you've got a huge push towards consumer engagement. And I think the industry has noticed and it's needed. But there have respective challenges there. We've got the challenges of apps. You know, providers and patients can get to those apps, and there's a lot of discussion, controversy on the quality of those apps and the use and transfer of that information. And then, and just to think ahead from that, I'll let you address that, and in the time we have, I want to hit maybe cloud computing and BYOD, and what do we have to keep in mind for privacy and security issues there?
Oh, okay. Well, yes, patient engagement is, you know, a top priority. That's what we're all looking for. But as far as privacy and security, we really look at that and encourage sort of a just big picture shared responsibility approach to that. So, you know, with vendors creating easy to use privacy and security features, we know that's critical, and communicating about the importance of privacy and security as part of what they do. And then with providers, understanding the privacy and security requirements and really evaluating and mitigating the risks. I mean, those are just key to what needs to happen. And patients also playing a role. So that's sort of how we see, you know, the ecosystem is just really shared responsibility. And really privacy as not so much a barrier, but as you know, it's an opportunity to make the consumer more comfortable with the product and embrace mHealth. So.
Excellent, thank you.
Maybe, David, I'll start the BYOD discussion if you want. So I think, you know, this is, we're all pretty much aware of what it is and the trend, and I think it's a great trend, by the way. I think it really makes caregivers, physicians, other caregivers much more efficient, mobile, effective if they can have a device that they use for other things and they can also use it for healthcare. I think the challenges are really around two issues. One is encryption, or let's say patient data. I mean, ideally, and the solutions that Dell works on do this, there is no patient data ever stored on that device, right? There's a visualization of the data on a screen and then it goes away when the user goes off onto the next thing. That's not necessarily the way all systems work today, and that can be a problem. So encryption is one issue. And the other issue, which doesn't get a lot of attention, and we actually have a solution that focuses on this, is the interaction between the healthcare app, and I use that term sort of loosely, and the other apps that are on that device. You know, people can download all kinds of stuff onto their iPhone, and we don't really know how that's going to affect the healthcare app that's then downloaded either by the consumer or by the physician, you know, in some way. So we've actually created, you know, built what we call a wrapper, which actually wraps around any healthcare app that you want, and will protect it from other applications that are on your iPhone or your Android device or your Windows phone or whatever. It doesn't really matter, because you want to make sure that there's no interchange between those devices, and there's, you know, some other app isn't recording, you know, the clinical information that's coming down to the phone, even if it isn't being stored there. So I think those are kind of the two issues. Is one is on the sort of encryption and what's stored side, and the other is protecting the application itself. And then I think, you know, there's going to be the constant problem of which are the good apps and which are the bad apps, and, you know, because there's hundreds of healthcare apps. And there's actually an organization out there right now called Haptique, which is actually curate. Their mission is to sort of curate apps and work on app prescribing, which is sort of maybe the next step after e-prescribing is app prescribing, and basically help healthcare providers figure out which are apps that maybe work in their situation and don't. So I think, you know, just the way we have, you know, Zagat for restaurants, maybe this will be kind of a way of curating or managing the number of applications that are out there.
Excellent discussion, and I think it's a challenge. It's facility specific. You know, lots of discussion has to take place on defining the rules and defining the workflow and the process. In terms of cloud computing, you know, Rohit, you know, you mentioned the use of Gazelle, and you mentioned the use of the challenge, I guess, for Quest, and you are kind of sitting in an interesting spot because, you know, people are coming to get the data from you from different platforms, different providers, different perspectives. What are some of those privacy security challenges that you address or need to be addressed?
Yeah, I mean, it was definitely an interesting concept for us. I mean, because as a general notion, you know, we spent a lot of our time and energy focusing on how we get diagnostic services information and developing solutions for providers, you know, the ordering physicians. And then over the last few years, though, we've had a direct policy, and this is true. I mean, every survey that has been done, right, in saying, you know, what kind of information would you like to access, right? You know, from a healthcare point of view. You know, number one out there is lab results. We've had other attempts at PHR type applications back at Quest Diagnostics, and we did focus groups and surveys and all that. And, you know, what would drive your, you know, adoption, you know, lab results. And so we felt we had to take a stance and take a step in this particular direction, which is what ultimately, through a couple of different generations, became Gazelle. And it's purely a mobile application, and you know, available on a couple of different platforms, which I know we will continue to expand and deliver. And it's fascinating, right? I mean, the feedback that we get is for something, you know, that is seemingly trivial, right? I mean, you're the patient, it's your data, you should be able to get access to it. But when people actually see that information out there and have the ability to sort of trend it over a period of time, it's just fascinating in terms of the reaction that we get. The hurdles that we had were generally policy oriented, and then there's some other sort of informational hurdles as well. I mean, first is from a policy standpoint, as I referenced earlier, there are certain regulations that are still in play in more than a handful of states. I'll just leave it at that. That prevent us from delivering this information back to the patient without the provider's consent, and so it has to follow that particular pathway. So that was an area that we looked at as well. And so one of the ways we started off there was connecting our Care 360 applications to, patient-facing solutions that are out there. Health Vault is an example of that. So we built in those connections. So, somebody with a Health Vault account could come in and then link those solutions up so they get access to that data. There were some other, providers in that arena, but that's an evolving space as well. The other notion is also an interesting topic. Is being able to uniquely identify a patient, right? I mean, we have to go through a lot of let's say work to make sure that I was trying to pick the right word here without offending people. So to make sure that we consolidate that, the Rohit Naik in Cincinnati is the same as the Rohit Naik who was in Washington, D.C. some years ago.
Columbus, Ohio.
So those, how we manage the master patient index was also an area. And then the final linkages was everything. Most of what we do is still based on the ordering providers, being able to identify us as the patient, back to the provider, and back to the account that was created from Gazelle. So it's getting better. We're getting smarter about it. There are other people doing some interesting things as well, but those are some of the areas that we were.
No, I was just going to add is, just listening to you guys is that, being the sort of healthcare IT security company, there are tons of security solutions out there. There's no shortage of them. I mean, we do everything from electronic prescriptions to texting to access controls to patient stuff. The challenge is what Dr. Litt said, is making it so simple and easy and still convenient. Because the minute you put security in that it becomes a barrier, no doctor is going to use it, no clinician is going to use it, and no patient's going to use it in the end. It's too much work. And so that's the real challenge, is how can you build solutions and systems that are secure and that take care of patient privacy and can address all the issues you want, but at the same time are simple and easy to use as perhaps, writing a prescription. No more extra steps.
Excellent point. Great discussion. And the time has crept away from me. This went much faster than I expected for 75 minutes. We have 10 minutes remaining, and more than welcome questions. And I know you came here with an agenda, so first question. Thank you.
Yes. I want to know why professional hackers are hacking into health data. What are they using it for? Are they wanting to steal identity and it's easier to do that than to do financial data anymore? Or is it that they're going to commit some fraud, for example, against the Medicare system? Do they really want to know your care about what the result of your latest colonoscopy was?
That's a great question. What is the value of that data? I mean, what is the intrigue to look through a car window and see a laptop and take it?
I think there's a couple of things. First of all, just to be clear, a lot of the hacking that's going on is not necessarily to actually get the healthcare data. So hackers actually go into hospitals and hack into them because from the hospital they can then go other places, right? The hospital's linked to Medicare. The hospital's linked to the state health agency. And there's a lot of places that they can then access because they're already beyond a certain security barrier. I think, look, I'm not sure that I know the answer to your question. It's why they're using it, why they want that data. I think it is, there is potentially value in, targeting things at people when you know something about them. And maybe that's where, and there are illegitimate people out, as you know, out there, because everybody gets those emails, right, that say, that are selling you something that you don't necessarily want, and not from a reputable store or whatever. So I think that's part of it. I think part of it is because it helps expand the sort of identity theft issue. It makes your data, the data more credible when they're trying to pretend to be you, et cetera. But I don't have a good answer to your question.
I think part of it is also because they can, right?
Well, that's true.
I mean, hackers by definition, and I don't have the right definition, but came into existence because they were smart, found the time, and wanted to do it. And for those non-purposeful, seemingly, activities, the ability for them to just expose data, right, in a manner that can then be harmful for all the reasons that Omar mentioned, I think probably has to be a basis by how we look at the industry as well.
How you personalize that,
Right.
right? I mean,
Right.
if someone sends you an email and says, please sign into your, Bank of America account, you're not going to do it. But if they say your account number ending in this is suddenly expired, or, it's just personal information. Personal information has value, I guess.
Thank you. Next question, please.
So I have two very quick comments and a question for the panel. The first is for Dr. Litt, that actually the Washington Post said in an article in August this year that there are over 40,000 health apps out there, and it's growing every day. Second of all, I want to commend you on the point that you raised about putting the wrapper and reminding us of the risk of the interchange of data between health apps on a patient's phone. I never thought about that ever, so well done there. And my question is, actually, I'm thinking of the needs of the people who are most likely to use these apps in the future and these devices and sharing data. So in terms of the younger people, I was even thinking of going into a local school where I live and just saying, okay, I can give you a free seminar on actually educating you on data literacy, not just in healthcare, but generally, because these kids are growing up just the digital generation, and they're sharing like you would not believe, whereas we think much more about the risks. But so, do you think that that should be in the national curriculum in every school, that the kids should be growing up being taught about the risks of their data, where it's stored, and knowing about that?
I mean, I'll answer. I think the answer should be yes. I mean, far be it from me to talk about education policy. I have enough trouble talking about healthcare policy. But it's certainly, I think you're raising a good point, which is that as the technology changes and as children start using the technology earlier and earlier, that's the time to educate them on some of these issues. I think that's a fair point.
There's also a notion of, and I'm not the expert either, but of is there a new normal in terms of what is considered, I know it's related to the point that you were just saying, there's a lot of information being shared, right? I think we have to be smart enough, that we continue to evolve what we consider as acceptable in keeping with the times that we have here. So I think that's a great point too. So.
Yeah, excellent point. And generational issues, I mean, kids today, very early age, and they copy what they see, right? And so they're out there using text, and they're out there, they don't know the implications. So it's a great awareness item. Thank you. Yes, sir.
At the very beginning of the discussion, there was talk about texting in the hospitals and the security risks that are, outside of these apps, outside of EHRs, presented by just the fact that people are sending each other text messages about things they shouldn't be sending in text messages. So I was kind of wondering if you could come back around to that. Anyone who wants to comment, really. What can be done about that? I mean, it seems unlikely that you're going to get people to stop doing it. So what's the security solution?
Well, so first of all, I think that this goes back to the problem that texting is a standard tool that everybody uses because it's convenient, and there are solutions that are designed to be secure, HIPAA-compliant texting solutions. This is one of the reasons why we're in this market. As I think I mentioned earlier, is that we released the product like 6 weeks ago. We have over 300 hospitals that have downloaded it, simply for one reason, because they want to be HIPAA-compliant. And the CIO, when you talked about information, floating around, it's not the text that's going between, physician to a nurse, or from a nurse to a doctor, or from physician to physician. What they're worried is all those texts, all that information, all those images they take of a rash or of an EKG is sitting on Verizon and Comcast servers and can be seen and accessible by anybody. And so that's when the worry comes out. I think the biggest information that has come out to me from this panel alone is, we talk about meaningful use and being HIPAA compliant and all that, but this is a patient issue, and when patient information gets out, patients are very upset about this stuff. And so, we have, a secure texting application that solves this kind of problem. And for us, one of the biggest challenges was, and this is the interesting thing, is when we were working to design the application, the security part, there are it's difficult to make security easy, and we had to work really hard to do it, and I'm sure somewhere out in our California office there are a few dead engineers from exhaustion. But besides that, it's actually designing an app that the doctors want to use in the way that works for them. So until you actually spend the time with clinicians recognizing little attributes that, for example, doctors, when they're not on call, they don't want the text to be coming in because they don't want to suddenly log on and find out there's a history of text that they have to now respond to. That's more work for them, right? So, or being able to find, one of the most complicated things in a hospital is finding someone. So how do you log onto your directory and then find someone and then send them a text? So solving problems like that is what makes the application more applicable to healthcare specifically. And then I think once you have solutions, you'll find lots of people will adopt them. I'm a firm believer that if you build the right thing, they will come. And in healthcare, I think doctors and clinicians want to do the right things. They want the right solutions.
I think that's exactly right. I think you're also trying to change behavior, right? And changing behavior is hard and it's never complete. So anybody who's been in a hospital in the last 5 years has walked into an elevator and there's a nice sign on the elevator that says, please do not discuss patient information in this elevator, right? Now, that's obviously not for the patients, right? That's for me, the physician, not to talk to my buddy and say, what'd you think about Mrs. Smith's gallbladder, right? And why did those signs get put there? Is because people were using actually the first form of communication, which is speech, right? So I think, things will change behavior. One of the things that frankly will change behavior around texting and some of this other stuff is when the lawsuits come, when this gets involved in medical malpractice suits or other forms of litigation. Unfortunately, that's our system in this country. When that happens, that will radically change behavior.
So you're telling us the takeaway lesson today is to advocate for lawsuits? No,
Right, we forget something is that, we do a lot of business internationally, so about 25% of our business is internationally. So why would you have, there's meaningful use is the driver here. What's the driver internationally? These all single-payer systems. The driver internationally is that if a patient gets upset, it's going to be on the front cover of a newspaper, and the politicians are going to be called to task.
Absolutely.
Right? When it's your information, think about it. When it's your information that you don't want out and it comes out, you will retaliate. Because that's all you have.
Right, as you said, you can't put it back in the box.
You can't put it back in the box. And that's why you have to make sure that it never gets out of the box.
Hey, one last question.
Oh, great. HIPAA is a little long in the tooth at this stage. HIPAA was really not anticipating what we're seeing happen with access and patient desired access to their own data. The speaker from Quest alluded to how this is a new and emerging area and how state laws are also to some extent governing a lot of this. Where do you think this is going in terms of protection of the data, but not to the extent that consumers cannot directly get their own medical information? And also information that's being collected, with reference to a Wall Street Journal article from, I think, Friday or Saturday about information that is being collected by device makers that, again, patients cannot directly access.
Right. I think...
Thank you.
Sure. I'll try to respond. I think it was multifacets. It's a great question, and it's a sort of one of those ongoing topics that I think we'll continue to get better at over time. I'll use some words here. I think the approach that the ONC has taken, and I look at it as sort of the bulldozer approach, saying, here's the extent of engagement that you absolutely need to have, between the provider and the patient, is forcing the community to figure out ways to build not just those 2 or 3 things that are written there in the checklist, but to actually drive actual bi-directional communication between them. And I think by virtue of doing that, each one of these solution providers, whether it's just in the secure texting or otherwise, are looking to make sure that when they do that, they're doing that in authenticated manner, they're doing that in a secure manner. So I think the underpinnings of what is needed from a technology standpoint are well understood by the solution providers, and the aspect of the use cases being forced on making that happen is by definition going to give us as consumers more access to the data. I don't expect it to be an easy journey, but it's going to take us as consumers or patients to actually carry that flag as well, because I think that's going to drive behavior. If I can just go back to that whole texting conversation, the reason we're talking about texting is because we believe it drives behavior, right? I wasn't the first person, I wasn't very active on texting until recently. And the only reason I did in the final analysis was because I found that people responded when I did that, and that they otherwise would not. So I changed my behavior because I needed something, right? And did that. I think, so we're trying to solve all the aspects and dimensions around texting right now, because that seems to be the most impactful method. But as time goes on, I think we'll similar to the question that you had, we'll find something else, 10 years from now or 5 years from now that's going to come back and replace texting as we know it, and some other more means that we will then, figure out ways to make secure as well.
But to answer your first part of your question on HIPAA, actually HIPAA is much more detailed. It may be long in the tooth, but it's fairly comprehensive. The issue around HIPAA has always been implementation of HIPAA and the audits against HIPAA. So it was only about 3 years ago that HHS did its first audit of a hospital for HIPAA compliance, right? And meaningful use stage 1 was still focused on acute care hospitals. Meaningful use stage 2 takes it down to ambulatory. So, I can't name them, but there are a lot of ambulatory practices who have bought systems, have no level of security, know that they're not in compliance, and have no, because it was just too much hurdle and they didn't want to do it. But as meaningful use stage 2 and 3 get rolled out, the level of audits is going to go through the roof. And the basic underpinnings of what HIPAA has is, it's a core foundation of security, privacy, and access controls. If you don't have that, then the rest doesn't even matter. It's moot.
So we're about out of time. Unfortunately, it's been a great discussion. I think we've had some good takeaways. I've jotted a few ideas down. We've got some analogies to learn from with texting. Everyone is comfortable with texting. It's simple, it's easy, convenient. We need to take that methodology and apply it to privacy and security. We can't put it back in the box. I think that's a huge issue and a foundational issue here for us to understand. The awareness and education for all players in the mHealth space is very important to embrace privacy and security and what are these issues and challenges. And lastly, integration of security into the mobile device to begin with would take us a long way, as well as with apps. So thank you for your time, and let's give our panelists a round of applause.